In which of the following non-cardiac surgeries would cardiopulmonary bypass, CPB, be most commonly utilized? A. Craniofacial surgery. B. Lung transplantation. C. Liver transplantation. D. Abdominal aortic aneurysm repair. Answer: B. Lung transplantation. Explanation: cardiopulmonary bypass, CPB, is typically used in procedures that require temporary support of heart and lung function. While CPB is mostly associated with cardiac surgery, it can also be used in non-cardiac procedures, such as lung transplantation, to manage pulmonary circulation during the removal of the diseased lungs and transplantation of the donor lungs. Which of the following is a major risk associated with cardiopulmonary bypass in non-cardiac surgeries? A. Acute renal failure. B. Increased cardiac output. C. Hyperglycemia. D. Decreased blood pressure. Answer: A. Acute renal failure. Explanation: the use of CPB, especially during non-cardiac surgeries, can lead to several complications, with one of the most significant being acute renal failure. This can result from decreased renal perfusion during bypass, inflammatory responses, or the use of nephrotoxic agents. Management of renal function during CPB is crucial to reduce this risk. What is the primary function of cardiopulmonary bypass in non-cardiac surgery? A. To support the function of the kidneys. B. To provide a bloodless surgical field. C. To temporarily replace heart and lung function. D. To control bleeding during surgery. Answer: C. To temporarily replace heart and lung function. Explanation: the primary role of CPB during non-cardiac surgery is to temporarily replace the functions of the heart and lungs, ensuring oxygenation of the blood and the removal of carbon dioxide. This is necessary in surgeries where direct access to the heart or lungs is required or where normal cardiovascular function cannot be maintained during the procedure. During a non-cardiac procedure involving cardiopulmonary bypass, which of the following monitoring methods is essential for assessing the adequacy of perfusion? A. Central venous pressure monitoring. B. Blood gas analysis. C. ECG monitoring. D. Temperature monitoring. Answer: B. Blood gas analysis. Explanation: blood gas analysis is critical for assessing the adequacy of oxygenation and ventilation during CPB in non-cardiac procedures. It allows the surgical team to monitor pH, oxygen, and carbon dioxide levels to ensure proper perfusion and gas exchange. While other forms of monitoring, such as ECG and temperature, are important, blood gas analysis provides real-time information on perfusion status. What is the main challenge in using cardiopulmonary bypass for non-cardiac procedures? A. Increased risk of infection. B. Increased inflammatory response. C. Difficulty in maintaining blood pressure. D. Limited availability of bypass machines. Answer: B. Increased inflammatory response. Explanation: the use of CPB in non-cardiac procedures can trigger a significant inflammatory response, often referred to as the systemic inflammatory response syndrome, SIRS. This can result from contact between blood and the artificial surfaces of the bypass machine, leading to the release of inflammatory mediators. Managing this response is a key challenge during non-cardiac surgeries that involve CPB. In which of the following scenarios would the use of cardiopulmonary bypass be considered most appropriate in a non-cardiac surgery? A. Elective cesarean section. B. Resection of a brain tumor. C. Resection of a thoracic tumor. D. Laparoscopic gallbladder removal. Answer: C. Resection of a thoracic tumor. Explanation: in surgeries like thoracic tumor resection, cardiopulmonary bypass may be necessary to provide temporary circulatory and respiratory support, especially if the tumor is located near or involves the heart or major blood vessels. This allows the surgeon to perform the procedure while ensuring that oxygenation and blood flow are maintained. Which of the following is a key component of managing patients undergoing cardiopulmonary bypass during non-cardiac surgeries? A. Administering prophylactic antibiotics. B. Maintaining normothermia. C. Using a higher concentration of anesthetics. D. Restricting fluid intake preoperatively. Answer, B. Maintaining normothermia. Explanation: maintaining normothermia, normal body temperature, is critical in patients undergoing cardiopulmonary bypass, especially in non-cardiac surgeries. Hypothermia is often used in cardiac surgeries, but for non-cardiac surgeries, normothermia helps avoid complications like coagulopathy, decreased renal function, and delayed recovery from anesthesia. Ensuring proper temperature management is part of a comprehensive approach to prevent complications during CPB. Which of the following complications is commonly associated with the use of cardiopulmonary bypass in non-cardiac surgeries? A. Fat embolism. B. Pulmonary edema. C. Stroke. D. Graft failure. Answer, B. Pulmonary edema. Explanation: pulmonary edema can occur in patients undergoing CPB during non-cardiac surgeries due to increased hydrostatic pressure and altered pulmonary circulation during bypass. It is important to monitor for signs of pulmonary edema postoperatively, especially in procedures involving major thoracic surgery, where the lungs are manipulated and perfusion is altered. Which of the following is an advantage of using cardiopulmonary bypass in non-cardiac surgeries? A. It significantly reduces the duration of the surgery. B. It allows for better control of the surgical field. C. It eliminates the need for anesthesia. D. It prevents all intraoperative bleeding. Answer, B. It allows for better control of the surgical field. Explanation: one of the main advantages of using CPB in non-cardiac surgeries, particularly those involving the heart, lungs, or large blood vessels, is that it allows for better control of the surgical field. By temporarily replacing the function of the heart and lungs, CPB enables surgeons to operate with a bloodless field and reduced motion, which is essential in delicate and complex procedures. During the use of cardiopulmonary bypass in non-cardiac surgery, which of the following measures is essential to minimize the risk of hemolysis? A. Maintain optimal pump flow rates. B. Use a higher concentration of heparin. C. Monitor for high blood pressure. D. Increase the oxygen concentration in the bypass circuit. Answer, A. Maintain optimal pump flow rates. Explanation: hemolysis can occur when blood is exposed to high shear forces in the CPB circuit. Maintaining optimal pump flow rates is essential to minimize these forces and reduce the risk of red blood cell destruction. It's also important to ensure that the bypass circuit is primed correctly to avoid air bubbles and that anticoagulation is properly managed to avoid clots.